Hi, everyone, and welcome. I'm Larry Gifford. I'm a member of the Michael J. Fox Foundation Patient Council, co-founder of the PD Avengers. Like many of you, I'm living with Parkinson's disease. I was diagnosed in 2017. I had DBS surgery in 2023. And over time, I've learned just how important it is to have the right people around you. Not just medical care, but for support, guidance, and sometimes a little cheerleading. Today, we're diving into something that affects us all: how to build your best Parkinson's care team. Whether you're newly diagnosed or years into your journey, your care team plays a huge role in how you manage day to day and long term. It's not just doctors, it's therapists, family, friends, the community you surround yourself with. It's also about knowing when to add new people to your team and how to get the most out of those relationships. So, this conversation is actually part of our Parkinson's IQ plus U series that travels across the US. I've had the honor of moderating those in-person events before, and I can tell you this topic always sparks great questions and stories. And speaking of questions, if you have one during the webinar, just type it into the Q&A box on your screen. We'll try to get to as many as we can towards the end of the show. Closed captions are available in English. Just click the CC button on your media player. And yes, the session is being recorded, so you can watch it again or share it with others, and the link will be sent directly to you. I'd also like to take a moment to thank our sponsors for this episode, who have also sponsored Parkinson's IQ plus U: Acadia, Blue Rock at the diversity level and inclusion, at the diversity, equity, and inclusion, Premier Partners level, AbbVie and Amneal as event sponsors, and Genentech as a DEI supporter. Before I introduce our esteemed guests, I'd like to take care of a few housekeeping details. If you want helpful information about building a care team, check out the resource list on your screen. Like all of our webinars, this session will be recorded and available to watch later on demand. It's a great resource to share with loved ones who couldn't attend the live event, or just rewatch it at your leisure. The on-demand version has captions available in a few different languages. You can find a link to upcoming Parkinson's IQ plus U events in the Take Action box on the right of your screen. And finally, if you're experiencing AV quality issues, please check the icon on your screen to make sure you have a strong Wi-Fi connection to support the live stream. Before we begin, I want you to think to yourself, who is one person, medical or otherwise, you couldn't face Parkinson's without? All right, let's get into it. I'm thrilled to introduce you to today's panel. First, we have Christy and Prentice Brooks. Christy was diagnosed with Parkinson's disease in 2013, lives in Arizona with her husband and care partner, Prentice. Hi, folks.
Hi. I was diagnosed over 10 years with her. And a year ago with MSA. This is Prentice, and he's my spouse and my caregiver.
Hi, everyone. Yes, I do. And I've been part of our care team from the very beginning, and I'm glad to be a part of this program.
Great. Next, we have Dr. Rachel Dolan. She's a movement disorder specialist, a lifestyle physician, and a principal medical advisor at MJFF. Hello, Rachel.
Hi, glad to be here.
Next, we're joined by Dr. Cristina Colon Semenza. She is a physical therapist and assistant professor of kinesiology at the University of Connecticut. Welcome.
Hello. Hi, Larry. Hi, everyone. Glad to be here. Thanks for having me.
And finally, please welcome Dr. Jessica Galgano. She's a speech-language pathologist and co-founder of Open Line Speech and Communications. Hi, Jessica.
Hi, Larry. Hi, everyone. Thank you for having me. I'm happy to be here today.
Okay, so what is a Parkinson's care team? Let's start with the big picture. When you think of a care team, what does it mean to you personally? How has it changed your needs? How has yours changed as your needs shifted over time? What kinds of roles show up on your team beyond just medical experts? So because Parkinson's doesn't just affect movement, it can impact mood, memory, sleep, digestion, speech, and more. It takes more than one doctor to handle it all. That's why the best care isn't solo, it's team-based. Think of it like this. You're the CEO of your Parkinson's journey. Your care team is your all-star executive staff, each with their own superpower, all focused on helping you live well. Whether it's your neurologist fine-tuning your meds, a physical therapist helping you stay strong, or a speech therapist making sure your voice is heard. Everyone plays a role in supporting your health, independence, and quality of life. Remember, the person with Parkinson's is guiding the care team. It is not a passive role. All right, Prentice and Christy, when you think about your Parkinson's care team, formal or informal, who's the first person that comes to mind and why?
Yes. She really reflects what we want from everyone and what we want, the message we want.
So the movement disorder specialist?
Yes.
Yeah. Would you agree with that, Prentice?
Yes, and we are very fortunate to have a very good movement disorder specialist, and she is kind of like the quarterback of Christy's team, and we rely heavily on her to guide us through this whole journey since we've been here in Arizona.
Great. And Rachel, if someone doesn't have access to a full care team, what's a good first step? What's a small action they could take to strengthen their support system?
It's interesting because, I asked this question to my followers on Instagram, I like, where are you with your care team? And about a third of people said, I don't even know where to start. And so I think for a lot of people, Parkinson's or not, we go to the doctor and I think sometimes we just think that's it, or that's the full care. And there's so much more that is part of care in Parkinson's, or that can be part of care in Parkinson's. So I would say the first step, of course, is your doctor. That's your first into care. But then it's about asking the question. Like I said, I think a lot of people don't even know that there's a broader team accessible to them, or what that should look like. And you don't have to know what that should look like, but you do have to know to ask about it. So if you're seeing a Parkinson's specialist or a general neurologist, or even your primary care doctor for your Parkinson's, ask who else can or should be part of my team. And that starts the conversation and the discussion about who and when you should add other care team members.
Great. I think this is a very important point that we should acknowledge. Not everybody will have access to a full team, and that's okay. The goal here is to help everyone find what works where they are, even if it starts with just one trusted provider or care partner. Christy and Prentice. So Christy, who is on your care team?
So we have the MQS, and we have the neurologist, and I have PT and FC.
And Prentice, of course.
And Prentice, that's it.
And Prentice,
And
how has your role evolved?
My role is that I help, coordinate a lot of the activities, between the people on her care team. Like we meet every 3 months with the movement disorder specialist. We meet weekly with the physical therapist and also with the speech therapist, and about 3 times a year with her urologist. And I would add there's another support system. We're part of a group called Moving Out Parkin, which is members of the community, similar to your Larry, the PD Avengers, and they're a very important part too as well. And we meet with them several times a year.
Oh, that's great. That is terrific. I was diagnosed in 2017, as I said earlier. My care team includes my wife, Rebecca, and my son, Henry, who was 6 and now he's 16. So his role has evolved. Before I was like, just your role is to let me know if I'm tremoring. Now it's obviously changed a lot. And as the quarterback of my care team, I tap my family doctor, Ramon, my movement disorder specialist, Jonathan, my pharmacist, Abe, and a collection of therapists that I rotate in as needed. Rachel, why is it beneficial to see a movement disorder specialist over a general neurologist?
Well, again, caveating that, as you said, that not everybody will have a movement specialist near them or accessible to them. There's a shortage of movement specialists, so they're just not available in some areas or for some people. But if possible, seeing a movement specialist, a movement disorder specialist, is what we recommend, simply because movement disorder specialists are general neurologists who've gone and gotten extra training in Parkinson's and related disorders. So they've done extra work to get that extra experience in diagnosing and managing and caring for somebody who has Parkinson's. So it's a numbers game. They simply see more people with Parkinson's, whereas a general neurologist may see some people with Parkinson's, but they're also caring for people with all kinds of other neurological conditions. A movement specialist is really focused on Parkinson's and related conditions. So you're more likely to get somebody who knows all those nuances of Parkinson's, can help you assemble that full care team that we've started talking about, and maybe more likely to be up to date on the latest advances and research opportunities for you.
And as you first meet a patient, what kind of conversations help you figure out if it's a good match?
Well, I think there's no specific conversation or one question. It's really about, we often liken this to dating, right? So it's about building a relationship. So you're talking to the other person and getting a feel for how they respond, and if they listen to you, and if they open space and time for your questions or for emotions you might have around this or for following up. And so it's really, we say, try to get to somebody who's a movement specialist, so you have that expertise and they're available in many areas of the country. And then once you get that expertise, it's really about the person and their approach. And again, whether you feel like you can have a good relationship with them, because you are establishing a long-term relationship. So it's about, do you feel heard? Do you feel like they're explaining clearly answers to your questions? Do you feel confident and
Okay, thank you. I have one more question for Christy and Prentice. How did you pick your MDS after you moved to Arizona? Because you moved after your diagnosis.
Well, we didn't pick her. Someone that I work with gave her to us, referred to us, and we went with it.
Yeah, yeah, she was highly recommended from the friend that worked at the same organization that we worked at. And once we, met with her, and we've been with her the whole time, it's been a very good match. She's been really supportive of Christy, and she also has been supportive of my role. I'm part of Christy's care team as well.
That's great. Thank you. Okay. My MDS was thrust upon me during my diagnosis process. I didn't even know what an MDS was or what it did. I got very lucky. My gait was a mess, so he recommended physical therapy right away. I showed up with an attitude like, fix me. That was not the right attitude, by the way. And learned quickly that there are remarkable things that physical therapists can do, but you do have to do the work on your own. Christina, when you first meet a patient, what kind of conversations help you figure out if it's a good match?
Right. So I would just echo what Rachel was saying. So much of it is about building rapport. But at the center of that is understanding what the patient's goals are and what matters most to them, so that then you are together working towards that common goal that is most important and prescient for that patient in front of you, that person in front of you. So really aligning your treatment, your efforts, your activities along with that patient's goal. And hopefully that starts to then build that rapport naturally. So really goals and what's meaningful in their life and what's front and center for them are the questions that I'm going to be asking when I first meet with an individual living with PD.
And Christina, if the neurologist that you're seeing or your MDS does not recommend a team until a problem arises, what's your advice to those folks?
Right. Thank you so much for that question, Larry. I really appreciate it. So one of the models that we like to use here in my lab, and that is really a model that is taking more hold across the US in terms of management of Parkinson's disease is engaging with a physical therapist very early on in the disease process. I so often hear individuals living with PD say, "Oh, I don't need a physical therapist. I'm doing really well." And so I say, that's wonderful. We want to keep you doing really well. So we highly recommend that the same way that you engage with your movement disorder specialist or your neurologist at diagnosis, to engage with a physical therapist at diagnosis. Because the same way that the medication that you take to help you manage your Parkinson's disease will evolve over time, so will your exercise and physical activity needs evolve over time with your disease process, your goals. So having at least, a yearly check-in with your physical therapist will allow you to even get baseline measures. So if you're doing great, you were just diagnosed, you're not having any problems, wonderful. Meeting with a PT now will allow you to understand, what is my strength like? What is my balance like? And we have some objective measures to help record that and then be able to track that over time so that if we see changes, we can act accordingly.
Well, for so many people, at least for me, I'm gonna extrapolate out. I didn't realize I could gain motor function back.
Yes.
Like my walk was wonky, and my arms weren't working right, and the physical therapist really helped me almost like rebuild my walk.
Yes.
It was great.
Yes. So yeah, thank you for bringing that up, Larry, because often, right, when we hear a progressive neurological disease, the thought is, well, there's nothing I can do about it. And that's what's so amazing about engaging with your physical therapist. And what I love, obviously I'm biased, about physical therapy is that it really is empowering the person living with the disease to take some control over an otherwise uncontrollable situation. So just like you said, Larry, you're like, I realized I had to do the work. So we as physical therapists are often giving the tools to the individual living with Parkinson's disease to take some control back over their lives. And I think that helps with both the motor and the non-motor symptoms that you often face. So yes, change can happen. You can get stronger and improve. Yes.
Okay, now it's time for you, Jessica. Are you ready? Okay. I've taken speech therapy, and I believe it's one of the reasons why my voice is as strong as it is. It was fading in the afternoons, but I really took it before people said I needed it, because just like Christy was talking about. And so, when do you recommend someone talk to a speech therapist, and how do they know who to trust?
Two very good questions. Well, I'm very much in line with what Dr. Dolhan, what Christine were both saying. The sooner, the better. And especially with speech pathology and what we cover, those thinking, communication, swallowing needs, we want to prevent versus treat when we can. And so it's so important, I think, upon diagnosis to see a speech and language pathologist, really to get a sense of that baseline level of performance or skill that you have in maintaining that loudness you need to be heard and to be understood, to make sure that you're feeling comfortable about your executive function, how you're paying attention, how you're remembering, how you're communicating with language, and then also how comfortable you feel with your swallow. We don't realize how those little things that we're nervous about, swallowing a pill, drinking, thin liquids, or trying to gulp, and having one swallowing issue at one point can scare the heck out of us and then make us feel like we're having swallowing problems when maybe we aren't. So these are really great times for you to reach out to the speech pathologist who hopefully you've been in touch with from the beginning, to make sure that she or he or they can provide you with the education, the comfort, the confidence that you need to stay strong, to be heard, to be understood, to swallow safely. And then to find out, sorry, Larry.
I was just going to say, I found out last year that I've been swallowing pills incorrectly my whole life.
Oh, no.
Yeah. So I would throw them in there and tilt my head back and swallow, and that closes your throat off.
Yes.
And so let them float back with water and swallow that way, and you won't have as many problems swallowing.
Right. Yeah. There are so many different strategies. It's so individually based, considering what you're experiencing, what's happening at the level of your body, and also your mind, because that can have such an impact. So, yes, I think that working with someone, and as Rachel was saying, voice whatever's going on with you, talk about it with your team, and they will either address it themselves or point you in the right direction so you're able to get that care that is likely out there.
Yeah. Rachel, when do you decide to refer someone to a specialist?
One, if they have challenges that we know a specialist can help with. So you heard Jessica talking about, speech, if speech changes or if you have any kind of swallowing. Christina was talking about any kind of walking, even if you want to just get started on an exercise program. So if we see anything where we know a specialist can help and or medications or current treatments don't fully address those symptoms like walking or like speech changes, then we're quick to refer. The other time is when people ask. So, again, a moment to feel empowered and to ask, should I see a speech therapist? Should I see a physical or occupational therapist? What can they help me with? And then two things I just wanted to underscore from our conversation to this point is, one, as Christina was saying, even if your doctor refers you, have a goal. And you can come up with that goal with your therapist or with the physician that you talk with. But Larry, you had so beautifully illustrated this with saying, one of my goals was to be able to walk hand in hand with my wife without feeling off balance. Your goal can and should be something like that matters in your daily life. My goal might be to be able to have my spouse hear me and not shout from room to room like we all do. So whatever it is that makes that goal and that therapy important and tangible for you. And then I didn't want to leave out mental health professionals. So we often default to thinking about physical therapy, occupational therapy, speech therapy. But mental health therapy can be so helpful throughout the journey, but especially at the beginning. And I think that's a place where people maybe aren't aware that that's available when you're processing a new diagnosis or you're even wondering what your next step is. That's something that should be considered as well.
That's great. Thank you, Rachel. I did have an occupational therapy that was a lifesaver. I was so tired by 10 or 11 o'clock in the morning, and I couldn't figure out why. So she walked me through my day. She said, okay, Larry, tell me if I'm wrong, but you have Parkinson's. You walk onto a slippery, wet floor in the shower. You try to balance yourself. Turn around, tilt your head back, close your eyes, and shampoo your hair. You've used up so much precious energy, but just getting ready for the day. No wonder you're so tired. So go buy a shower chair. It was life-changing. Just those little things. And that's what great therapists can do, is they can hone in on those little things for you. Christy and Prentice, I want to hear more about your community extended network of support, the friends, the community, the members, the support group functions as part of your care team. Talk about those folks, and you said you get together a couple times a year, or?
Yes, the group it actually started before we got here, and so the person that recommended us to the movement disorder specialist, she was actually the leader of that, and she has since moved away. And what the group does, it's really, really impactful, because everyone has Parkinson's or knows someone that has Parkinson's. And so they get together a couple times a year, especially bringing new members on, and also supporting a lot of the fundraising events that happen here in the Phoenix area. And then also just getting together to talk about, hey, what's working? Is there anything that we can do to help you? And it's a really supportive area. And then also some of the group, they come together and they have lunch. Christy will invite Christy to lunch, and they'll get a chance to get together and it's a really good way of building community with other people.
Yeah, I have, based on absolutely no scientific research or data, I believe community is as important as exercise. It's just my personal opinion, but I think, whether it's through improv or through going to lunch or dinner with somebody, or we had a supper club with YOPD here in Vancouver, where every quarter we'd get together at a different restaurant or somebody's house, and it's great. And I think it's super important to stay in community, because once you have those connections, you can rely on those people a lot. and they get it. You're not starting from 0, you're starting from 50.
So Larry, your hunch.
Go ahead.
Yeah, Larry, although you're saying that that's your hunch is completely in line with the evidence and the data. There is just a strong, strong, strong body of evidence that supports community-based interventions and how they are critical for both our mental and physical health.
That's great. I want to get a little deeper now and go into actually finding and building this network of people. So Rachel, what can someone expect for their first visit with the movement disorder specialist, and what questions should they ask?
Your first visit will, of course, be longer because your doctor is getting to know you and you're getting to know your doctor. So they're finding out all about you, about your Parkinson's symptoms or what symptoms you might be having, how long you've had them, how they impact your life, et cetera. And then they're going to ask you all kinds of other things like any new doctor does, about where you live and, other things that are important to you and other medical conditions that you might have, et cetera. And then they're going to do a detailed physical examination. So, lots of things with movement in general, but they'll have you tap and open and close your hands, tap, things like this, where we're testing your movement, how big and how fast your movements are, because those tend to slow in Parkinson's. We'll watch you walk down the hall, we'll test your balance, etc. So it's a really detailed visit where, again, we're really getting to know you and your symptoms and your Parkinson's. And we're evaluating you to see how those symptoms are playing out in your body and what they look like. So it's a lot of talking, a lot of going through exam steps. And then it's, again, on your first visit, like we talked about before, you're assessing your doctor too. So you're looking at, how do they listen to you? How do they answer your questions, et cetera? And you're seeing too if it's a right fit for you.
Yeah. Christina, how can people find a good physical therapist?
Yes, thank you for that question, for sure. So as physical therapists, we are all trained as generalists. That's what every physical therapist that's licensed in the United States will be. They will be a generalist. However, there is now a movement and a trend towards residencies and fellowships. So you will find that there are some physical therapists that have some advanced training, and then they have obtained a board certification in a specialization. So for example, I am a board certified by the American Physical Therapy Board, a specialist in neurologic physical therapy. So that's something that individuals can do if they're looking for someone, a physical therapist who has specialized knowledge of neurologic physical therapy. They can look for someone with this designation of an NCS. And there's actually a really useful tool that's out there online through the American Physical Therapy Association. And it is choosept.com/find a PT. So even if you just Google choose PT, find a PT, you'll find that website. And within that, you just enter in your zip code. And then you can even filter your search so that you can say, I want to find someone with specific specialization in neurology. And that's available freely to everyone through the American Physical Therapy Association to help you find someone who is a specialist. But then, of course, you need to go through that same process of, is it a right match? Are we aligned in our, in our goals, in our approach? Do we have that rapport?
And are there certain questions people should be asking when they meet with you?
So, yeah, I mean, you should feel free to ask the questions of, what is your experience in working with Parkinson's disease? Do you have a predominating framework or approach to treating people with Parkinson's disease? So understanding their knowledge, their experience would be really useful for you to understand the context from which they are practicing from.
Okay, Jessica, what helps benefit people the most at a speech therapy appointment? Oh, you're muted.
Sorry about that. What helps people benefit the most from speech pathology?
Yeah.
Well, a desire to do it, I think, would be the first and foremost. I think really going in and thinking to yourself, okay, these are individuals here to help me. here to help me identify where my strengths are, where my weaknesses are. And as they establish a plan of care for me, I am a huge, to feel like they are a huge part of the team. You know, I think, Larry, you mentioned it a second ago. Christine, you spoke to this as well. To go in expecting people to fix it for you is not always the best way to approach rehabilitation. It's really about going in, and even if you're not feeling so empowered, when you're working with the right individual, they will help you feel empowered, to build that confidence, to get that motivation back, to be able to fully participate and live successfully with Parkinson's, to fully participate in these programs, to be able to really participate in your lives more easily. So I think it's that motivation, that desire to want to feel better, to want to improve.
I think that's key.
And if I can just underscore that, what you said earlier, Larry, it's about being an active participant. So with a lot of this, it's you get out what you put in. So, you know, if you're given exercises, I'll say, you know, I'm in physical therapy and I'll say, oops, I didn't do my exercises. And they say, well, that's fine, but you're not going to get better. Like, you know, so you get out what you put in, and, you know, and if it's doing exercises and you need help from your care team at home to help motivate you to do the exercises. But the important thing is putting in the, you know, the work on your part to get out what your care team is putting in as well.
And you can't just be like the dentist where you brush your teeth the day of the appointment. You got to do it every day.
Yes, absolutely.
Yeah, can I just add a little bit more to this topic of conversation, though? So yes, I would agree with everyone. Obviously, active participation is key. But I also want to highlight that apathy or problems with motivation is a symptom of Parkinson's disease. So right there lies the catch-22, right? So you might want to improve your speech or improve your walking, and you might have the information from your speech therapist or your physical therapist, but then putting all of that together is a challenge because of a symptom of the disease, which is problems with motivation. So having a real honest conversation with your therapist about how can you support me to maintain and have that motivation. So something that
Rachel, I think you're scratching through with your microphone. Maybe not. No, you're muted. Okay, somebody listen.
Yeah, I don't know where that was coming from, but it seems to be resolved now. But something that I have found is really useful is not only just prescribing the exercise, but building in accountability for that exercise. And that can come in many different formats. It can be like, okay, I want you to practice for 10 minutes every day, this really large amplitude, large steps, really aggressive walking. And we create either through an app or just pen and paper or a paper calendar. I want you to check it off each day when you do it. And maybe write some notes on the days that you did do it and you didn't do it so that we can discuss how last week went when you come back in for the following week. So there really needs to be an environment of accountability to help people follow through on those plans and achieve their goals.
And I think to piggyback on that, Christine, is to really, and is to have also some faith in the providers that you see, because those who are doing these intensive therapies, really evidence-based for people with Parkinson's and those atypical Parkinsonisms, is that the intensive therapies, the nature of the programs themselves, when they are administered correctly, will strengthen those motivational circuits that we know can become impaired as Parkinson's progresses. So therapy itself will aim to motivate you even more. It kind of snowballs in the right direction. Once you get started and you fully put yourself in there, you allow your care partners to be a part of that journey. You've got your therapist coaching and motivating you along the way. It will get easier to feel that motivation to want to participate more and more as you go on. So I think it's that initial getting into the office, seeing that provider, establishing that relationship, and then trusting that together you with the team, a partnership, you will strengthen that motivation to be able to succeed and live successfully with Parkinson's over time.
Christy and Prentice, what's been your experience with therapists? Different therapies, PTs, OTs, speech.
They're really good. But my speech therapist, she knows speech, but she's not sure she knows me.
Ah, yeah. So that's an interesting, Jessica and Christina. How do you build trust, and how do you get to know your patients?
Well, I think every therapist is a little bit different. And I think it depends on the setting where you seek therapy. If you're going to big outpatient center where it's difficult to see your therapist for a longer period of time or for multiple weeks, versus in a private practice or a different setting where you might be able to really see your practitioner for at least an hour at a time, almost every day per week for many weeks on hand. And I think through those relationships, because I do a lot of those intensive therapies where I'm seeing people at least an hour a day, 4 or 5 days a week for the first month. And through that process, it's just such a joyful, wonderful way for me to get to know people, to know their goals, what's important to them, what scares them, and what things that I can do grounded in the evidence, but also taking into care the holistic needs of the patient to be able to provide them with the best outcomes. So I think it's the time that I spend with people, the in-depth interviews and assessment process that really helps me get to know physical, emotional, mental aspects of what's going on with them as they live with Parkinson's. So I think it's the time and it's the nature of me explaining my background, what's important to me when I'm treating someone else or someone. And it's really all about what's important to them, their families, the communities that they participate within day to day.
That's great. Rachel, there is a shortage of movement disorder specialists right now. We tell everybody to go see a movement disorder specialist, and there's not enough to go around. Why is that an issue, and what's being done to address it?
There's many reasons this is an issue. Some of it is just generally less people becoming doctors or less people becoming neurologists, and then fewer people becoming movement specialists, and that's happening for a variety of reasons. There are programs, including one we lead at the Michael J. Fox Foundation, to train more movement disorder specialists. So we have the Edmund J. Safra Fellowship in Movement Disorders, which every year funds medical centers around the world to train more movement specialists. And so that's expanding access to care. And also because they're trained as researchers at the same time, it's continuing that forward research momentum. So there are some things that are happening. Telemedicine has been another help to a lot of people with expanding access to movement specialists in many ways. There's also a growing population of people with Parkinson's. And so even the numbers that we have, as the number of people living with Parkinson's continues to increase, that shortage will continue to increase. So as we've acknowledged multiple times, we want everyone to see a movement specialist if that's a possibility, but we know that it's not possible for everyone. And I do want people to know that you can still get good care. May take a little bit more on your part. You may have to do a little bit more homework, like we've talked about with your therapist, asking your neurologist, what's your experience in Parkinson's? How many people with Parkinson's do you see? Do you have extra education? Have you taken a course, or do you go to annual conferences where you learn more about this, etc.? And then there are movement specialists, as I said, that might be accessible through telemedicine. So look into that. I have a lot of people too who say, I spend, half my time in this place, and then I spend half my time in another place. Maybe there's a movement specialist in that other place. Or maybe you visit your grandkids once a year and they're in a location where there is a movement specialist, and you can build in a visit once a year to a movement specialist along with that visit. And then, last but not least, there are ways you can access the expertise and knowledge of movement specialists through things like this. So there are plenty of webinars, online resources, et cetera, where you can access movement specialist, maybe not personal to you, but in a broader way where you can get some of that expertise as well.
Christina, you work hard to improve access for care for underrepresented groups. Can you tell us more about that work?
Yeah, thank you for that question. So yes, and directly related to this access issue, we have just recently wrapped up a study where we were creating a completely virtual intervention to create support, not only peer support, social support of people living with Parkinson's disease, but also provide specific support for exercise and physical activity for Hispanics or Latinos that are living with Parkinson's disease. So as everyone's been saying, this community and social support has been so important for so many people's lives. And unfortunately, that same level of community does not exist currently for some of our underserved populations. So we created an intervention to create that community virtually. So we brought people from all over the United States, including its territories like Puerto Rico, who are bilingual, who prefer Spanish as their first language. And we had a 12-week intervention where we had everyone exercising together, meeting together, getting that support. And we found some initial indications of this being positive for reducing depression, increasing physical activity, increasing social support. So we are really excited that, yes, this telehealth or this remote access seems to be able to bring us together even when we can't be together in person.
That's great. That's great. Thank you for doing that work.
Yes, you are welcome.
Prentice and Christy, any appointment tips you've picked up that help make things smoother or more effective?
What we do before every appointment with as part of Christy's care team is we sit down and we talk about, what are the one or two key points that we want to discuss, with, each one of her doctors. And so that way we go into those appointments, with that information. And Christy always asks me, is there any questions that you have, too as well? Another good thing is that you don't want to overwhelm your doctor with so many questions. So what we do is we also utilize the patient portal in between appointments for things that come up so that, those can be answered real time or within a day or two. And that has been very, very helpful, especially where Christy is right now in her journey, with MDS.
Yeah.
Did I say, I'm sorry.
Rachel, Christina, and Jessica, how do you stay in the loop with the other providers on a person's care team?
I can start. That can be a tough one. And I hear this a lot from people, I have so many doctors, why can't they just talk to each other? And they should, or I have so many providers, not just doctors, but I have so many providers, why can't they just talk to each other? And they should, but the reality is there are a lot of challenges around that communication. So that's where, again, you can be your own best advocate. So one way I tell people, if possible, try to see your providers in the same location. If you're by a major medical center, try to see everybody in that same location, or at least locations where that they use the same medical record system, because then everything's in one system. And so it's much easier for people to, at the very least, even if they're not talking, refer to other notes and be up to date on what happened, or what, if I send somebody to Christina as PT, then I can look at her note and see what was done, what she recommends, etc. So that's the first thing. The second thing is a lot of doctors will print out or give you a visit summary describing or summarizing what they did or what changes they made and why those changes were made and what your next steps will be. Ask for a printout of that, or make your own really detailed notes, like what Prentice talking about, being in the visit, and maybe one of your roles as a care partner is taking notes. So just make sure that you're keeping a good list, whether it's a printout or your own notes, and then keep them all in the same place and take that to every appointment. So then you can say, if your gut doctor is saying, well, what did your Parkinson's doctor say? You can flip to that page and say, here's what they said at our last visit. So you can facilitate some of that communication through these other ways. And then the last thing is, sometimes, especially if you're getting conflicting advice or you're confused or you're saying, I'm not sure, should I still be on that medicine from my cardiologist because you're saying my blood pressure is low, but I'm not sure. Say, can you talk to my cardiologist? Would you call my cardiologist? Sometimes you need to just ask the direct question. And I would bet they won't say no. but you need to ask them and encourage them to talk and say, you all talk, please, and then come back to me and tell me what I should do with that medication.
Yeah. Or you could always see your pharmacist who could talk about the interactions of the pills. I do want to take a moment to call out the Foundation's landmark study, the Parkinson's Progressive Markers Initiative, also known as PPMI. It's recruiting volunteers. People from all backgrounds with and without Parkinson's can help move research forward. Join the study that's changing everything by clicking the link in the resource list. Rachel, if someone wants to get involved in research, what kind of providers should they connect with?
Well, they don't have to see any specific provider. So that's thing one. You can find out about research on your own. So the Michael J. Fox Foundation has a tool that holds all ongoing trials called foxtrialfinder.org. And you can go there and see what trials are available in your area. But the second place is, like I said, any provider. You might just need to ask the question. So we actually talked with some community doctors, and they said their most common reason for referring somebody to research is when somebody asks, but not that many people are asking. So you simply need to ask the question. And if they say, I'm not sure, say, can you help me do that research? Or is there a place I can look, whether it's Fox Trial Finder, or there's another one called clinicaltrials.gov. But there are many ways, that you can find out what research is available and that you can get involved. You sometimes might even need to bring an opportunity to them and say, hey, what do you think about this for me? And help, open that discussion so they can help you work through it.
Yeah. Coordinating all this morass and getting all the therapists to talk to your doctors can feel like a full-time job. I'm wondering, Christy and Prentice, how do you stay organized between appointments?
Well, we have a calendar that is it's a virtual calendar, I should say, and it also is a family calendar so that our 2 adult kids can also see what's going on. And so we keep that calendar up to date every week. Christy and I, we talk about it at the beginning of every week, to look at what appointments are coming up and, how do we need to get prepared for those. And then once an appointment, after we meet with a doctor and we schedule a new one, then we put that on there automatically all the time. So it's constantly updated. And that's the best way we've been able to manage that, with everything. And so it's a moving target. We try and do the best that we can. Occasionally an appointment will, fall through the cracks. I would also encourage everyone to opt into with your healthcare provider for getting communications from them as far as reminders of appointments. And we had that situation happen last week that we both weren't aware of an appointment, and it was because of the email or the text reminder. It's like, oh, we've got this appointment coming up this week that we need to go to. So that's another way to manage that, is to opt into those communication options that your healthcare provider or your doctor provides for you.
Do you have advice on if like the family member with Parkinson's isn't on board with the extra support, if they still want to be independent for everything, how you can get them to take that extra help for therapy? I'll throw this to anybody.
That's a good question. That's not a situation with us. We do know some friends of ours that's a challenge, and it's really the care partner is the one that's really driving that and constantly encouraging them to take these options as far as care that's really helpful for them.
Anybody else want to chime in on that one?
Yeah, I think Larry, that one would come back to showing the value. If the individual living with Parkinson's disease can find the value and align what's important for them with the service that's being provided, I don't think there would likely be as much resistance. So I think it's approaching it with lots of time and space to say what matters most to you. And I want to attune these services or this help so it's in alignment with what's most important to you. right? This is for you. It's about you. Talk to me about how we can work together instead of having like this opposition, which I think is what I hear you talking about.
And the talk about is the key, right? So I think oftentimes we assume like they just don't want to do for XYZ reason, but maybe there's something else there. Maybe they don't like the physical therapist, or maybe that, you know, the appointment time is at a not a time when they want to watch their show or whatever it is. But you know, if we don't ask, we don't really know. And so it's about asking, being open, being curious, approaching people in a gentle way and from a place of love and genuine support and having their best interest in mind, and saying, hey, you tell me, just talk to me and tell me what it is, why it is that you don't want to go. And maybe we'll agree that we table that for now. Maybe there might be a way to work it in if we both agree that this is what's best right now.
Okay. So building a care team is not easy. I think this is what we've come to a conclusion with. It can be frustrating. It takes time, but when it clicks, even just a little bit, it changes everything. We want you to walk away from today not overwhelmed with one idea or one next step to explore. So we're going to move on to Q&A now. The first question is, somebody's husband has Lewy body dementia. Are there additional members that he needs to add to his care team?
Well, I can start. Of course, as with anything, whether it's Lewy body dementia or Parkinson's, the care team is very personalized to what symptoms you have and what's most bothersome to you. So start there. Are there symptoms that are not being adequately addressed right now? And you don't have to know who the care team member might be that could help with that, but you do have to feel empowered to bring that up to your doctor and say, these are the things that we're struggling with. Are there other ways, whether it's different medications or treatments or other care providers who can help? You know, so you'll want to think about physical therapy, occupational speech therapy, like we've talked about, you know, but again, if there are other symptoms or things that are not fully addressed, especially in something like Lewy body dementia, where the medications may not fully address all of the symptoms, that's where other members of the care team do become that much more important. And then the other two things I'll say is, you know, in something like Lewy body dementia, where memory and thinking changes are some of the most prominent, you can talk with your doctor about whether it might be helpful to see a doctor who specializes in memory and thinking. Now, that may not be necessary depending on the doctor that you're seeing and whether you feel like you have a good relationship and they have good expertise to offer there. But sometimes people will consider, you know, that additional physician as part of their care team. And then the second thing is, like we've talked about with Prentice throughout, but maybe we haven't underscored enough, is making sure that as a care partner, you're getting support too, and you have your own care team. So in, you know, everything that we've been talking about and in all of the visits, it's natural and it's right that we're focusing on the person who has Parkinson's or the person who has Lewy body dementia. But we don't want to leave out the care partner or make them feel invisible or like an unrecognized member of the team. And sometimes that means that you have to advocate for yourself. So you need to introduce yourself or reintroduce yourself as the person's care partner and why you're there and what your goal is. And you need to ask for the support you need too. Again, you don't need to know what support that is, so don't let that stop you from asking. But if there's any place you're struggling or feeling like you could use extra help, bring that up and don't feel you know, embarrassed or like there's not time to bring that up. Make that part of your top couple of concerns to bring to the doctor in the visit.
And here's a related question. How does the care team need to change over time as Parkinson's progresses?
Well, I can start again, but Prentice and Christy, you certainly have experience with this, so it'd be good to hear from you all as well. But it, you know, as Parkinson's changes, of course, symptoms change. So symptoms may increase, new symptoms may develop, other symptoms may kind of fall down on the list of priorities or list of bothersome, most bothersome ones. And so it's about being in tune with how Parkinson's is changing and then what we might need to change to address that. So if walking becomes more of a problem or if falls start to happen, then again, we may want to bring in physical therapy. We might, hopefully we've had them already, but maybe we need to bring them in again, or maybe we need to bring them in for the first time. Or if speech changes or you're having drooling or swallowing problems, again, we'd then want to bring in speech therapy. If mood changes become more prominent, maybe it's revisiting mental health therapy or even a psychiatrist. And something too, just on this note, is people will often say, how do I know when to go somewhere else? How do if I start with my Parkinson's doctor, how do I know when to go somewhere else? So a lot of times your Parkinson's doctor is able to manage a lot of, if not all of what comes with Parkinson's, at least at the beginning. But then, say you have anxiety and we've tried multiple medications and we really just can't get control of it and it's still really bothersome. We might say, let's have you see a psychiatrist for help. And same goes for something like constipation. We will do a lot, and there's a lot of tools and tricks that we have to help with these things. But if it gets to a point where what we're doing isn't working and you're still having a really bothersome symptom, then that might be when we bring somebody else on. So the bottom line of how your team evolves, it's going to be very personalized, but it's going to be in response to how Parkinson's is evolving.
I also think it's very important to talk with your therapist, talk with your doctors, because as Parkinson's progresses and things come up here and there, you don't know if the current therapist who you're already seeing deal with that in some way. And I think many times in speech pathology, for example, people forget we also do a lot of counseling within the scope of communication, swallowing, executive function changes. We also do a lot of work with executive function and really working on those cognitive communication skills that can be more impacted later on in the course of the development of Parkinson's, which sometimes we don't even see in the early part. So talking with your therapist, talking with your doctors about new things that come up to see if there are evidence-based approaches that they use to target those things now that you're experiencing them in ways that you didn't have to earlier on.
Yeah, this is Christine Mary Chavender. First, she did something later saying he's on. So when my symptoms become worse, I'll go to a different medical provider for that. Like I had UTIs and I kept having UTIs. I knew, oh, I need to see urologist.
Yeah. So you added a neurologist later in the game.
Right. I am before.
Got a urologist and a neurologist.
She also had
so many allergies.
Yeah, she also had an event with her heart, and so had to add a cardiologist to as well. And unfortunately, we've not had the challenge of them not communicating with each other. And so our, like say our quarterback is the movement disorder specialist, but she gets updates from all of them, especially as we have appointments with them throughout the year too.
Great. One more question. This might be for Christina. I care for my 82-year-old mother that does not speak English well. She has trouble explaining her symptoms. How can I get better understanding of how to help her?
Okay. So I'm not sure I'm understanding the question exactly. Is it that the primary language of this individual's mother and the primary language of the adult child are different?
Different.
Yes. That's a really good question. I don't know that I have the answer to that, except from a clinical, excuse me?
Flashcards?
Well, that's a challenging one. I mean, in the clinical environment, we have like language lines and translators and things like this to help us when someone's preferred language is different from the preferred language of the provider. But within the home environment, I don't know that I have a good answer for that. And actually, I'm wondering if Jessica, you might have some tips on that.
Well, I think I also have some questions. I think it depends on exactly what is happening. If, for example, the person with Parkinson's who's home and speaks one language is home with their loved one who doesn't speak the same language, but you can hear and you can hear the voice, you can hear the speech sounds clear. You could use something as simple as Google Translate, which is really effective these days at helping to translate other languages into the language that you understand. If there is more than just the actual language barrier, and it's more about the fact that you might not hear the individual with Parkinson's, or speech clarity sounds reduced, you might encourage them to use that speech with greater loudness. So we're always thinking about amplitude of movement with Parkinson's. So, you'll say, "Okay, Mom, I want you to try to say it again nice and loudly." So they will feel that loud. They won't, and they'll just get up to those more typical volumes. Then you'll be able, or Google Translate will be able to hear, translate, and understand those words so you can best communicate. So I think we're kind of talking about two different things here. The physical ability to hear and understand the motor movements of speech, voice and speech production versus the ability to understand linguistics, like the language being used, vocabulary, sentence structure to be able to communicate.
I wish we could go on forever, but we are at time. So Jessica, thank you. Christy and Prentice, thank you. Rachel, Christina, thank you. And thank you for being part of our community and joining us today. And thanks to our panelists, all your expertise. We'll be sending a link to the webinar on demand to watch again and share as you like. We hope you found today's discussion very helpful. Thank you and have a great day.
Bye.